Welcome back to Let's Just Do This. I'm Todd Miller along with Margaret Wallis-Duffy, back for our second season on Kojiko, and today we're talking about vision therapy.
We are, and we're always so excited to have both returning guests as well as new guests come to the table here at Let's Just Do This to help educate and empower and inspire you to live well. And today, vision therapy is a topic, and I have to tell you, it has been a game changer with many of my patients, and I've learned so much from the person sitting across from me. Dr. Teske from Eyes Focused on You has been in practice for over 24 years and is always looking for new ways to help her patients. And we're also thrilled to have Dr. Shirley Ha, who is also an optometrist and a neurodevelopmental optometrist. She is actually, I'm going to read a little bit of her bio as it is very impressive and something it's important for us to know. She's a board certified fellow in developmental vision and vision therapy by the College of Optometrists in Vision Development. She is also on the advisory board member of the Neuro-Optometric Rehabilitation Association. And you just got back from Hong Kong.
Yes, I did.
Speaking to a team of physio and occupational therapists about vision therapy. So are we ever lucky to have this caliber of guests on our show? Welcome.
Thank you. Thank you for the opportunity.
Well, I think it would be great to start off with you, seeing as you literally are just off the plane.
Suffering jet lag.
Indeed,
Yes.
indeed. One of your passions, both as a primary care optometrist, but now really focusing on vision therapy. For the average person sitting at home, what is vision therapy?
Vision therapy is where we apply activities and changing the person's visual process because they have adapted incorrectly. And sometimes it can affect how they view the world. And we want to make sure that they are seeing things the correct way, you might want to say.
Right.
And it can affect a person's ability to learn, as in children. And sometimes when a patient has a brain injury, it can actually cause them to have visual symptoms. And with vision therapy and rehabilitation, we can actually get them back on track. And symptoms such as blurry vision, double vision, and sometimes even headaches that you think might be just something else, it can actually be visual related. And
interesting.
Yeah.
Now I know, Dr. Teske, we've talked about vision therapy before in the show, but I love having both of you here to really explore this topic a little bit further. When you're, as a parent, there was a stat that Dr. Ha shared that really made my jaw drop with respect to children that are having difficulties in literacy issues or troubles in school and the connection to visual problems. Can you speak to that?
Absolutely. So thank you for having me again. It's always a pleasure. And today is really an honor. So Shirley and I probably graduated similar era, but she certainly brings a wealth of experience, which I admire, and am so proud to sit beside her today. Learning, 80% of what we learn is visual. And I think we discount the importance of the visual system until we see a problem. And I believe the statistic that is what you shared, 60% of patients who have a literacy problem actually have a vision problem.
Wow.
So it's really important that we start off our learning well, knowing that the visual system is appropriate.
And I think you said something earlier before we went on air, and that is a lot of these kids that are being undiagnosed are attributed with other illnesses or challenges that aren't correct, and it actually comes back to the eyes.
Absolutely. Learning deficiencies are often mislabeled for patients when really it's a vision processing problem. Mm-hmm. It makes so much sense that as a child you would be distracted and have difficulty focusing when your vision is not cooperating and you're not getting the right input to the brain.
Right. Now, how does lazy eye play into this when it comes to vision therapy?
Well, lazy eye, or amblyopia, they call it technically, is really a maladaptation. It's how the brain actually adapted. And it can be from an eye turn, or it can be a big difference between the two eyes when there is a focusing problem. And so what the brain does, it always likes the path of least resistance, right? So
Right.
It will find the most efficient way. So in order to avoid seeing double, it will actually turn the eye. And sometimes the brain will shut off the one eye, and that can cause the one eye to be the bossy one, and then the other one not to be as bossy. Or it might just try to keep things single, but it tries to blur one eye just to avoid it as well. And so there's two types of lazy eyes. And for us, what we try to do, we try to make sure that the brain work together as a team, that the two eyeballs are the only two parts of the brain that move. And we want to make sure that we eliminate any competitive rivalry between the two eyes and make sure that they team together and work together as a joint partner, as they should.
So it sounds like there's a stronger eye that's trying to take over most of the processing and
Yeah.
relaying the information, and the other one, you said it just almost shuts it off.
Yes, and exactly. Sometimes it's not the lazy eye that's the problem, it's actually the bossy eye. You just have to tell the bossy eye to back off and let the other eye come out and play. Let's put it that way.
So, as a therapist myself, as a massage therapist or any therapy, we think of it being very hands-on. I really want to get across to all of our listeners and viewers, when we talk about vision therapy, you actually do things physically in a vision therapy session to retrain the brain, correct?
Absolutely.
Can we talk a little bit about that? Because I really don't think people understand or what they can expect if they're going to go see a vision therapist.
Absolutely. With vision therapy, it's not just the eyes. We want to make sure it's a whole body experience. It's eye, mind, and body. And basically what we try to do, we try to throw visual challenges at you so that you can explore the environment that you're in and to make sure that you can actually handle the challenges and to solve them appropriately. And basically we want to know, do you know where you are? And do you know where the object that you're looking at, where is that? And also, what is it that you're looking at? And how did you acquire that information? What visual skills did you use, and are they efficient enough to acquire the information that you need to get? And once you've acquired it, what are you going to do with it? How did you interpret the information? How did you process it? And what is the outcome? And the motor outcome would be speech, would be writing, would be the motor output. Right. And so that's why vision therapy is not just for someone with any deficits, it's also for our athletes. Athletes already have, you would think, excellent visual skills, but you know what? They might just want that little edge, and they can actually still, everyone can improve. And vision therapy is for anybody, and age is not a limitation at all.
Oh, I love that you're bringing that up, that it is really for an option for consideration for all kinds of people with a wide range of issues, or as you said, maybe not issues, wanting to improve performance, which is really impressive.
So if I'm hearing this correctly, will this help with coordination and
Absolutely.
and accuracy?
For sure.
Incredible.
It's the fine motor skills. The eye movement itself is the finest motor movement in the entire body. So if you don't have the gross motor skills intact, it will actually mess up your fine motor. And then you don't know where you are. Then you become clumsier, and your depth perception will be off. And you might kick the ball, the soccer ball, like the little kid in a soccer game, they might actually kick the ball incorrectly. And worse yet, if their two eyes are not working together, they might see two balls.
Right.
But in day-to-day living, I think it would come into missing a step because you think the step is there and you miss it and you get injured.
For sure.
Well, there's certainly something, and I'd like to raise that issue about falls. I know recently, Dr. Teske, you lectured to Making Our Seniors Matter, a group that we're all very passionate about, and educating and empowering seniors and their families to live well. You were asked to speak about fall prevention and vision. Can you speak to that? And of course, vision therapy would play right into that in our senior population.
For sure. There's so many different candidates for vision therapy. We talked about learning disorders, but also post-concussion, post-stroke, which certainly in the senior population is very prevalent. And really, you've said it before, and we all agree that we deserve to be well, regardless of what age and stage of life that you're in. So accepting your post-stroke status is not necessarily the only option. So vision therapy certainly could help you accommodate to your new space, to your new deficit in terms of vision. Not very often, and I'm sure in your clinic, as in mine, there's a mini trampoline in my office. There's a walking rail. There's, balls hanging from the ceiling. So, we really, when we are holistic in our approach, which is our goal, the eyes are not isolated. They are attached to your entire body. So when we're doing rehabilitation programs or vision therapy, we need to bring that whole body into play.
Yes, absolutely. So, Dr. Ha, you just got back from Hong Kong,
Yes.
and I'm curious, and I love the fact, we're all about collaboration and, practitioners coming together to put the patient at the center, to help empower them and to see better outcomes. I love the fact that you were speaking to a group of physiotherapists and occupational therapists.
Yes.
Why is it so important for you to educate other practitioners, and what role can we as other practitioners play in making a good referral to you?
Well, it's definitely an interdisciplinary team approach in taking care of any illnesses, diseases, or whatever that a patient may have, because it's really not just one system. And unfortunately, in the modern world, we have our urologists, we have our cardiologists, we have our separate people, and we really need to break those silos. And I think, Dr. Teske had mentioned about breaking the silos. We really need to do that. We really need to talk to each of the allied professionals and make sure that we treat the person as a whole. And that's what holistic medicine is all about, is treating the system, not separately.
It's so true. It's so true, and I do love the fact. Patient outcomes come, but more importantly, they improve. The outcomes improve. But what I love more about it is how empowered that patient feels. So I've certainly witnessed at your clinic, Dr. Teske, patients leaving that have improved as a result of a concussion, for example. Can you just briefly explain what someone can expect when coming into vision therapy and what they can expect in terms, I'm sure it's different for every type of different condition and individual, but what can they expect when they're coming to see a vision therapist?
So I think initially what needs to happen, because every case is individual, you need to have an assessment. Every person, every problem, every challenge will be managed differently. So, even when we talked about preparing for today about what tools would we bring, there's a whole toolbox, right? There are so many different things and strategies that can be used depending on the case. So initially an assessment is done. Well, sorry, I should rewind. Initially, a fundamental eye exam should be done.
Yes.
So we do need to make sure that the eyes have a clear picture. And then the eyes bringing the clear picture to the brain is the vision therapy assessment, or a behavioral optometrist then would do a more functional assessment. And then once that assessment is done, then a treatment plan is determined and a vision therapy program is initiated. And that is carried on by a vision therapist. So it's an involved process, right? So we need engaged patients. We need patients who really are prepared to participate in this program, because it really is not just a pill for an ill, as we have experienced, right, with traditional medical model before. You have to be participating in this care. So so it's not an overnight fix, but it didn't take overnight to get to that injured status, right?
Absolutely.
You've said this before, and I think we have to be willing to want to make change.
And it's vision therapy is it's not a do-to program, it's a do-with program.
Right.
So the patient or the child, they really have to have the motivation and the desire and the will to want to do it. We don't want a parent to just drop a child off and expect our vision therapist to fix them, because we're not fixing anything. The ownership is really the person, and the person has to take control. Let's put it that way. When we talk to our kids, we say, "You're the boss of your eyes.
Right.
Let's see what you want to do with them."
Oh, you know what? I love that. And what a great way to just take a short break. I love the fact that we are empowering people to play a more active role in their health. So stay with us, because we're going to be right back in just a couple of minutes. We're going to actually look at maybe perhaps some of these tools that are used during vision therapy to help improve the health and well-being of all of us. We'll be back.
Welcome back to Let's Just Do This. I'm Todd Miller along with Margaret Wallis-Duffy and our two wonderful eye care professionals. And we're having a wonderful discussion on vision therapy. And I can't help but notice there's some wonderful things on the table and some tools/toys. Can we talk about them?
Absolutely.
For sure.
So this is a fixation target. It's a common fixation target, and optometrists use different ones. And I like my cube because it's got little shapes that I can use for the kids, and I can change it just in case they get bored. And what I would use this for is to check their fixation, just to see how accurate they are. And I can also move it around to check their tracking. And if I have two of them, I would check how they jump from one target to the next target. And that is the first time I actually get to know whether or not they know where they are relative to the object that they're looking at. Because initially, I'm not moving them. I'm not chasing them around. They're just looking. And when they do a couple rounds, I would ask them to do it as fast as they can. And when they're not able to do it, I'm looking for undershooting, overshooting. And because I haven't moved them, they really don't know where they are, where they're pointing. Okay. And I can also use this to check how close they can move their eyes together. And a common problem that many people have is called convergence insufficiency. I am binocular, so as I'm moving my eyes in, I can actually cross my eyes. But some patients, actually many of them, can't. And that will create blur when they read. They can't read for long. They might see double. They just avoid reading in general. So this is a
Which
great
is an interesting
tool.
point where, as young children, avoiding reading or, and it may just be looking like a child that has a behavioral issue when in fact they're really struggling to read. And without having an eye examination, that might get missed.
Yes, and it's not just children. Sometimes I would ask an adult, are you having any problems reading? And they'll say no. I go, okay. And as I'm doing it, they have convergence insufficiency. At that point, I say, well, you actually have an eye teaming problem. And the reason why they say that they don't have a problem is because they're not reading.
Right.
So,
that's very interesting
yes.
because that's certainly something I think of my mom right away. And if Mom, you're watching, I'm coming for you. Because she was an avid reader and loved to read. But only in the last couple of years has she been saying, and I'm not sure why, but she just, I don't like to read, or I'm struggling to read, which is very interesting. And she does have a really great optometrist, so we'll have to have a visit. But that is something to think about in terms of behaviors and quality of life for people. Often that we're robbed of things that we really care about. Reading can be an avid thing for some people, and you're robbed of that if you don't have your vision. Yeah. What else, Dr. Teske? What is this lovely striped thing on the table here?
I'm going to let Dr. Ha attack that one. She's our Neuro-Developmental Optometrist.
So because concussion patients or anybody with brain injury, including dementia, we have to really think about neurology here. It's not always just traumatically injuring your brain. It can just be general age-related. And so for when you do have a brain trauma, insult, or whatever you want to call it, sometimes you shut down the how you process the information. And what patients tend to do, they tend to go focal, or they tend to use the central vision a lot more and not incorporate the peripheral. So sometimes when I show them this, if they're not using the whole system, they don't like this. And it's a great clue immediately as to whether or not they have brain
So when you say they don't like it, what do you mean by that?
As soon as I show them to them,
they're turning away.
They're turning away completely, very quickly too. Yeah.
Interesting.
And then what we do is to reorganize it, because this is total, they can't organize the stripes, basically.
Oh, okay.
Yeah, they can't organize it at all.
Showing the camera.
Yeah.
So people
So I think we take for granted, all of these different processes that are happening all at once, right? It's not just is the picture clear, but what we do with the picture. Right. Even, with fixation, right? When you're reading, you scan right and left. When we're looking at those gradients, it's a whole picture, it's a whole process. And when you're accurate, there's no problem.
Right.
But once there's been injury, the new normal is not so happy. And that's what vision therapy helps train is, adapt to your new environment or try to restore the old environment that was happy.
Right,
Yeah.
right.
Because the space that they're looking at is very disorganized. So when we give them a stripe, like you said, that we take for granted, they can't organize it anymore.
Oh, okay.
And what we do, we would actually put prisms, something similar to this, but this is a big fat one, which I would not use.
You might
in
want
this
to look
case,
through that, Todd.
Yes, and we'll see what happens to his eyes. So what happens here, we would use something very tiny, just to reorganize it, to open up the peripheral space, and then they can function.
So it becomes less overwhelming then.
Exactly.
And they would actually wear that day to day? They would start to wear, or is it just during therapy?
No.
Just during therapy to retrain the brain?
Yeah, and sometimes with therapy, there's a phrase, I believe Dr. Greg Kitchener said this, but I'm not 100% sure. It's not really what anything or the tool, any tool that we do to the patient is what the patient does with the tool.
Right.
So that tool, that blank tool, you can add any noun to it. Because if you think about it, it's just like general foods. I mean, I could eat a peanut butter sandwich. It's not what I do with the peanut butter sandwich. It's not what the peanut butter sandwich does to me. It's what I do with the peanut butter sandwich. That's
Right.
my medication. You know, you can give somebody 2 aspirin, and one person will react completely
Completely different.
differently than the other.
Right.
So I love that phrase, that phraseology.
Right.
So,
Yeah. Really, really interesting. So we always love to give practical tips here on Let's Just Do This, so that people can, listen to the podcast and show, and then immediately go into their lives and do something to make a difference. What would be one of your top things that you would tell every single person when it comes to their eye health?
I think everyone should really have a good functional eye exam, because it is the best insurance policy for the health of your eyes, for the health of your sight. You want healthy sight and healthy vision. There is a difference.
Right.
I love that.
Yes, healthy sight is just making sure that structurally you're sound, that your eyes are healthy, that there are no diseases, there are no macular degeneration, cataracts, glaucoma, diabetes, or whatnot that you can be inflicted with. And also you have good 20/20 eyesight. Just because you have 20/20 eyesight doesn't mean that you can actually process the information.
Right.
So it's beyond that, and that's where you also want to have healthy vision. We want to make sure that you can function with what you take in as well.
And that's so powerful.
It's something that was missing from my generation was they tested your sight and then that's where it ended and there was nothing past that. So if your vision was bad, your vision was bad, but there was no correlation with what you did with that information that you saw correctly.
Right.
Correct.
Now, Dr. Teske, you've been involved with the program for a very long time, and I've had the opportunity of working alongside you at the baby show. I See, I Learn. We're so committed as parents, but as healthcare professionals, to our youth and the impact that vision will have for the rest of their lives. Can you talk a bit about the importance of eye exams in children and perhaps the I See, I Learn program?
Absolutely. So, often patients will say to me, well, how do you test a child? My daughter won't sit here, or my child won't cooperate, or they don't know their letters. Really at 6 months, with lights, with reflexes from the retina, we can have a pretty good idea
Did
of
everybody
what the
hear
visual
that?
system is.
At 6 months. That is, did you know that, Todd?
I did not know it was
There
that
you-
young.
There you go. I think that's really critical to point out. At 6 months, you should be bringing your child for an eye exam.
Or at least soon around that age.
Right.
Certainly before age 3. And that's what I See, I Learn is. So at age 3, when that child is registering their JK
Preschool.
program in preschool, then we want to be sure that the startup for school is good. So I See, I Learn is an association and government-funded program that encourages that first eye exam. Now, because we want no boundaries to that opportunity, then if glasses are required, we've had very generous sponsors contribute lenses and glasses so that if a child does need glasses, that pair of glasses is paid for.
Right.
And of course the Ontario government pays for the eye exam. So really it should be like first dental visit, first doctor visit, first eye doctor, and that's hopefully the message that I See, I Learn is bringing to the world.
I've certainly seen the impact that you've had on that program and the thousands of children that you've and families that you've helped over the past 24 years. So I think it's just so important to share that kind of information. We can't hear it enough, and new parents need to understand that their eye doctor is part of their healthcare team.
Absolutely.
And that they need to go to them. Even before they, talking to their family doctor about their eyes, they need to see an optometrist, which is so important.
Thank you.
When we were on a bit of a break, Dr. Ha, you shared a very powerful yet personal story that really, I believe, needs to be shared. Not only because your experience is now changing the lives of others because of what you went through, but because you're also willing to share it, which is why we're so thrilled to have expertise like you on the show that are so authentic. Can you please tell us what happened to you in grade 1 and how that's brought you to where you are now with vision therapy and making an impact on the lives of others?
Well, I was born in Hong Kong, and being Asian, it's very competitive, let's put it that way. My mom would be considered a tiger mom, and she and academics was number one thing in Hong Kong. And if I had stayed in Hong Kong, I probably wouldn't have gone through high school. I probably wouldn't be where I am today. In grade 1, I was actually expelled from my school, and I was very shameful. And I did not share this probably till maybe within the last 5 years. And the reason why is because I really didn't know vision therapy prior to that. So it's a blessing that I kind of found out about vision therapy. And I really feel now, knowing what I know now, I probably had a vision-related learning problem. I hated school. I did not like to read. And as a grade 1 child in Hong Kong, you had homework. So my life changed when I arrived in Canada in grade 4. There was no school bag, no homework. You would go to school, and back then in grade 2, I learned multiplication table. They were really, really hard on you in the academics. In grade 4, in Canada, they were just starting to learn. So I was actually excelling. And that felt good. That felt good. And I think that pushed me forward to go into university, did the optometry program, and found out about vision therapy and found out a lot about myself. So not only am I helping patients, I think I help myself.
Wow.
Yeah.
It almost brings tear to my eyes because I often believe, and this is certainly with my situation as well, and why I own an integrative clinic is because of my health story. Often our biggest struggles become the gifts that we can give to others. And having the courage to share that so authentically and to put now the energy that you do in to vision therapy, to helping other children that were like you, I just want to commend you and to thank you for sharing that on this show, because I'm sure there's going to be someone out there listening to this that's going to relate to your story, and perhaps just because they tuned into Let's Just Do This, we're going to make a difference together.
Awesome.
And as we often say here in this show, and the mission that Dr. Teske and many of us healthcare professionals, who I hope you are going to join, the Better Together mission, where we bring all healthcare professionals together, put the patient at the center, and empower them through education to play a more active role in their health. I got to thank both of you for sitting at the table today, imparting your knowledge and your experience and your stories to help us make a difference in the health and well-being of those that we can reach. Thank you for joining us.
Thank you so much. Thank you so much for inviting me.
It's been educational.
It sure has. So as always here, I learned something at this table, and I hope you have too. If you want more information, or if perhaps you have a show idea, or maybe there's something you're struggling with, we want to bring one of the experts to the table to help you and your family overcome these obstacles. So until next time, from Todd Miller, myself, and the entire team here at Your TV, be well, and we'll see you soon.